Okay, so next we're going to test her cranial nerves 1 through 12, and we're going to start with the olfactory nerve 1, and we are going to be testing for smell and interpretation. So I have this cotton ball soaked in something. I want you to smell it.
Vinegar.
Vinegar. Okay, so she got that one right. That's good. That's a normal finding. So next we're going to check her cranial nerve number 2, her optic nerve, and we're going to be looking at her visual acuity. So I've got a chart on the wall here. Avery, can you tell me what the top letter of that chart is?
E.
Okay. And can you cover your left eye and tell me what the first letter of the second line is?
E.
Okay, perfect. And cover your other eye and let that one down. And then the second letter in the second line.
C.
Okay, perfect. And that was accurate. So next we're going to check cranial nerve 3, the oculomotor nerve, by just noting that she is moving her eyes and she can raise her eyelids. Can you make her Okay, she can move her eyelids. And then we'll move on to cranial nerve 4, the trochlear nerve. And that's the downward, inward movement of the eye. Can you look down with just your eyes? Just your eyes. And can you look in? Cross your eyes. Okay, you can do that. Good. So next we're going to move on to the 5th cranial nerve, the trigeminal nerve. And can you open your mouth? And we're noting that she can open her jaw. Can you clench your jaw? Clench it. Very good. Okay, can you pretend like you're chewing? Okay, and she has adequate movement there. So next we're going to move on to cranial nerve 6, the abducens nerve, and that's the lateral eye movement. So we're going to see if she can move her eyes laterally, and she can. Okay, so then we're going to move on to the facial nerve 7. And can you smile and frown? Get sad. Okay, that was perfect. So next we're going to move on to cranial nerve 8, and that's the acoustic nerve. So I'm going to whisper something, and can you repeat it?
You're doing very good.
All right. And I'm going to come to this side and do it as well.
You're great at this.
All right, perfect. Thank you. So next we're going to move on to the glossopharyngeal nerve, which is the voluntary swallowing. Can you swallow for me? Swallow your spit. All right, perfect. And then we're going to move on to cranial nerve 10, the vagus nerve, and we're going to just note that she didn't have any swallowing difficulty, and that does also pertain to cranial nerve 10. Then I'm going to use a tongue blade, and I'm going to have her open her mouth, and I'm going to check her gag reflex. Okay, and she had a good gag reflex. So next we will look at cranial nerve 11, the spinal accessory nerve. Can you turn your head left and then right? And can you shrug your shoulders? Okay, and that was appropriate again. And the hypoglossal nerve, the cranial nerve 12, which is tongue movement. So can you try and touch your nose with your tongue? And try for your chin. All right, that was very good. Thank you. Okay, that was perfect. If you'll sit down, I'm going to move on and test your sensory function. Okay, so first I'm going to check her primary senses by using several different tools here. First, I'm going to have you close your eyes, and I'm going to touch you with something, and I want you, when I get done and say, to point to where I touched, okay? Okay, point to where I touched. All right, perfect. So next I'm going to move on, and I want you to tell me, I'm going to see your arm here, keep your eyes closed. I want you to tell me if this is sharp or not sharp. What is that?
Look sharp.
Okay. Can you point to where I touched? Okay. All right, and close your eyes again. Was that sharp or not sharp? Not sharp. Can you point to where I touched? And we'll do that one more time. Okay. Sharp or not sharp? Not sharp. And can you point to where I touched? Okay. So next I'm going to move on, and I'm going to test her vibratory response. Okay, next we're going to check her superficial and deep tendon reflexes, and we're going to start with the abdominal reflexes. She's kind of about to hiccup, but if you lay down for me. Okay, and I'm going to just take an object, and I'm going to lift your shirt up just a little bit. To check her upper abdominal reflexes, I'm going to take an object, and I'm going to stroke up, and I'm going to just note the flexion of her muscles, and to check her lower, we're going to go down and note the flexion, and that was appropriate. So next, I'm going to have you sit back up for me, and I'm going to test the deep tendon reflexes. Again, I do not have I don't have a reflex hammer, but I'm going to use what I have, and I'm going to start by checking her bicep tendon. So I'm going to hold her on my foot, like so, just relax here, and I'm going to just, okay. And next I'm going to go to the brachioradial, so I'm going to go a little bit lower down here, and I'm just going to, we have movement here, and just completely relax. And next I'm going to go to the tricep, so I'm going to hold her arm back here, just relax, and I'm going to gently use the hammer, and I'm going to check her patellar reflex. Okay. Perfect. And her Achilles reflex. Okay. And next I am going to check for ankle coolness by dorsiflexing her foot and the plantar reflex. I'm going to hold up her foot here, and I'm going to go around the lateral side of her